Welcome to today's GNCC Espresso Live with our distinguished guest, the Acting Medical Officer of Health for the Niagara Region, Dr. Hirji. Dr. Hirji, thank you so very much for being with us. And to all of our participants, really glad that you can join us. My name is Mishka Balsam and I will be your moderator for the next hour. Throughout the pandemic, we've learned that change is ever constant, and these past 4 weeks have been no different. Since our February Espresso Live, a number of factors have changed. In Ontario, COVID-19 mask requirements have been lifted for most indoor settings, meaning that as of yesterday, masks will no longer be required in schools, restaurants and bars, gyms, stores, and movie theaters. And when it comes to hospitals, medical clinics, long-term care homes, and public transit, the government has said that mask mandates in this category will lift on April 27th, effectively putting an end to the requirement across the province. Business, organizations, and venues are free to establish their own masking policies, some choosing to keep mandatory masking policies in place for now. Mandatory vaccination policies for employees at schools, childcare settings, hospitals, and long-term care homes have come to an end. And when it comes to isolation requirements, the province changed its COVID-19 isolation requirements last week, including dropping a requirement for non-household contacts who are unvaccinated to isolate. And for people who don't live with someone who has tested positive for COVID-19 but were identified as a close contact, no one will need to self-isolate. So these are some of the provincial updates. And when we take a look at the federal level, the Canadian government has eliminated the pre-arrival COVID testing at airports and land border crossing for fully vaccinated travelers entering Canada as of April the 1st. The government's vaccine mandate for domestic and international flights departing from Canada for via rail or Rocky Mountaineers trains or for cruise ships will remain in effect for now. And Health Canada authorized the use of the Moderna COVID-19 vaccine in children for 6 to 11 years of age. This is the second COVID-19 vaccine authorized in Canada for use in this younger age group. With all of this in mind, I want to thank each of you for being with us together to better understand our current situation right here in Niagara. What is our case count, our vaccination update, what to expect, and how to best move forward in a safe way. But before we get started today, let me thank our partners at Brock University Goodman School of Business for their commitment to leadership development, an initiative that makes people better leaders within their business, their public offices, or nonprofit organizations, and it's critical to the long-term success of any organization. Here to introduce the new program is Abdul Rahimi, Director of Goodman Group at Goodman School of Business.
Have you ever been asked to do more with the same? Professional development helps employees continue to not only be competent in their profession, but also excel in it. In fact, studies have shown that companies with a career development program demonstrate up to 250% higher productivity. Goodman Group within the Goodman School of Business is pleased to bring to the Niagara community the latest cohort of professional leadership development program. This specialized program equips leaders and aspiring managers with the tools needed to improve their efficiency and increase productivity by focusing on topics such as creativity and critical thinking, communication, remote work, change management, and personal growth. This program has been developed in collaboration with GNCC and other Niagara-based partner organizations and starts in May. The program is facilitated by industry leaders and award-winning GSP faculty who are at the forefront of thought leadership and practice. And some of our instructors include Dr. Andrew Godez, Dean of Goodman School of Business, who specializes in the area of remote work, and Dr. Barry Wright, the CEO of Canada 2022 Summer Game, who specializes in the area of leadership, and other esteemed faculty. You can reach us at Goodman Group at brocku.ca for assistance with registration, funding, or if you simply want to know more.
Thank you very much. Thank you very much to Goodman School and an amazing team of people that is really helping out businesses in Niagara and organizations within Niagara to actually really develop the leadership skills that are needed to deal with the challenges that all of us have and all of us are facing. Just a heads up too, there is funding available for those. And if you have any questions, please feel free to connect with us, and there's a link in the chat at the same time. And now back to our Espresso. First of all, I wanted to thank all of you for actually providing us with questions in advance of it. We're committed to getting to all of them. Just a couple of housekeeping items. If you want to enable live transcript, please refer to the bottom of your Zoom screen for that option. And just about the format, we're going to start out with Dr. Hirji, where he will provide us an update, which is followed by our interactive Q&A session. And you have two ways to connect with us. One of them is via chat, or otherwise raise your hand, and we're looking forward to your live question. And on that note, I'm going to pass it over to you, Dr. Hirji.
Hey, thank you so much, Mishka. And likewise, thanks to everybody for submitting the questions in advance. And I'll hopefully cover off a couple of them as I present, and then we can deal with the rest of them in the Q&A session. Just want to confirm that everybody can see my slides here.
Yes, we can.
Excellent, thank you. So I'm going to start off with a couple of slides, which I believe I presented in one of our last couple of sessions, because I think they're really good reminders of what we've accomplished and what has been some of the real successes that we've had with this pandemic. So this is actually some US data, which shows really the number of people who potentially died from COVID-19. This yellow bars here represents, the flu season in 2018 and 2019 going into 2020, and the number of deaths that the US had seen from influenza. And then when we have the COVID-19 pandemic, you can see just the sheer number of unfortunate deaths that we saw due to the COVID-19 virus, and just how bad this virus has been, and how it definitely has been a real step change in the actual morbidity we've seen of people dying from these viral infections. The good news here is that that's the US and not Canada. And if we take a look at the total number of deaths during the pandemic per million population, so per capita, we can see here in Canada that we are about a third of what the US experienced. And actually here in Ontario, we're a little bit below that Canadian average. And so we have had some real success here in Canada and in Ontario at preventing a lot of people dying from COVID-19, much more success than many countries in Europe, more success than the United States has had. And I think that's really a testament to the hard work, the sacrifices, a lot of the challenges that we've experienced over the last 2 years. And I think it's a reminder that, that it was not for naught. We did accomplish a lot. A lot of people are thankfully alive in our community because we did do that. Obviously, we weren't the best in the world. There are some countries that have fared better, but I think it's important for us to recognize that everything that we did that was so difficult over the last 2 years has actually had some real accomplishments. And I think as we now are in hopefully the end game of this pandemic, and we're heading towards the end soon, that we make sure that we don't, sacrifice everything that we have accomplished so far, and make sure that we don't see many more deaths, and we're able to make sure that this is pretty much the majority of deaths that we're going to see through the pandemic. In earlier months, I would spend a lot of time talking about our case numbers, because that was really a representation of what the pandemic was doing. And unfortunately, with testing being so restricted nowadays, it's no longer nearly as reliable a metric of what's going on in the pandemic. And I think we've also shifted to focusing a lot more on the severity of illness, particularly, for example, the deaths I've shown, but also the hospitalizations and how many people are becoming severely ill. And I just want to put a quick framework here to frame how I'm going to approach things. So if we think about COVID-19, there's, of course, you start off with some sort of transmission event where infection spreads from one person to another. That person perhaps then develops an infection. The infection in some cases will go on to being severe illness, and that severe illness can sometimes lead to a serious outcome for that person over the long term. And there's ways we can try and get an insight at all points of this continuum. So if we're looking at transmission, we're looking at infections, we can look at the COVID-19 in the wastewater, because that shows us a proxy for that. If we are someone infected with the virus, they're excreting COVID-19 into the human waste that they send down the toilet, so we can detect that to detect infections. And that's also a proxy for how much they might be transmitting infection to others. When it comes to, of course, infections, we're also able to still look at the number of PCR positive cases we have. It's not a reflection of the total number of people infected, but it does give us some sense of trend. We can look at the percent of people testing positive. If a greater percent of people are testing positive, that implies that a greater percentage of people who have symptoms of illness have symptoms that are actually caused by COVID-19 as opposed to another virus. So that implies there's more COVID-19 around. And we can look at how many outbreaks we have. If there's more outbreaks, that implies there's more COVID going around, and that's causing more outbreaks. If we go look at serious illness, of course, we can look at the people being hospitalized and being admitted into ICUs. And in the serious outcomes that we can look at is unfortunately the people who progress on to passing away or develop long COVID and spend an extended period of time suffering from the symptoms of that. Obviously, this is the last thing along the continuum. So this is the last sign that we'll see of what's happening with COVID. As we move towards the left here, we're going to see earlier and earlier signs of what might be happening. And so I'm just going to walk through all of these, actually starting on this end and working our way through to, try and get a sense of what's going on in Ontario right now and what's going on in Niagara and where can we see things going. I'd love to talk a bit more about long COVID, but unfortunately, we don't really have good data tracking here in Ontario, so I can't really see what the trend on that is. I do want to highlight, though, the UK does do quite a good job of tracking it, and they're seeing that it is a major cause of people being absent, missing work. And so I think it is a significant issue that we should be concerned about. And of course, the more COVID infection we prevent, the more we're going to prevent people from getting long COVID. But I don't know what the trends are here in Ontario, unfortunately. When it comes to deaths, though, we do have a better trend. And fortunately, the trend is a good one where we've had the Omicron wave. Unfortunately, a lot of people have passed away from COVID-19 during that wave, but we've seen those numbers coming steadily down. And we can see actually this Omicron wave was not even, in terms of people dying, did not lead to more deaths than the second or first waves, even though the number of infections we had was far higher during this wave. And that's, I think, thanks to vaccination, prevented a lot of people passing away. Important to note, though, that while we are trending down in deaths, those deaths are still higher than we were in the late summer and fall of last year. So we still have work to do to reduce the burden of illness to make sure we don't see as many people passing away from COVID-19 going forward. This is the pattern of deaths you've seen here in Niagara, and you can see, in January, when we're going through the Omicron wave, every day we are potentially reporting multiple deaths, and there's, of course, many days where we are reporting deaths every day. We've fortunately seen that spaced out, and we're seeing far fewer deaths here as well in Niagara. But, unfortunately, we are still seeing people in our community passing away, and we do want to try and get that as low as possible. Shifting then to hospitalizations, this is what the Ontario trend has been, and good trend here that we are seeing the number of people in hospital coming down, and likewise the number of people in the ICUs coming down as well. In Niagara, we are seeing a similar trend until pretty recently as well, where we are seeing that number come down. But unfortunately, over the last week, we've seen a bit of an uptick in hospitalizations. Don't see that so much with the ICU numbers. Those are staying pretty flat. And even if we look at the people who are actually admitted for COVID-19 as opposed to being admitted for something else and it's discovered they also happen to have a mild case of COVID-19, we are seeing that trending upwards. And so I don't know how much significance to attach to that yet, but I think it's a trend to watch for, that we are seeing a reversal of this downwards trend in hospitalizations over the last week or so. Maybe it's going to be something like what we saw here, where things went up for a bit and they came back down, and I certainly hope that is the case, but I think there is a little bit of a worrying sign there. And I just want to highlight, it's important to note that as much as hospitalizations have come down, our hospitals are still actually over capacity right now. They have not got to a point where they have been able to fully recover from that Omicron wave. And so our hospitals are still very stretched, and I think would struggle if, unfortunately, we did have any sort of big additional surge of COVID infections going forward. That brings us to cases. And of course, cases, as I mentioned, are underreported because we're not testing everybody. But because we've been consistently not testing most people for a couple months, I think we can at least see some sort of trend. So the solid line here is what we were able to detect when we were testing everybody. And then the dotted line is, since we've reduced testing, what have we seen? And you can see we were seeing a downwards trend in COVID cases that are diagnosed with PCR testing. But actually for close to a month, we've been basically flat. We have not been seeing those cases come down. We've basically plateaued out and it's remaining pretty flat at this point. And of course, it's flat at a level that is higher than we were, through the summer or fall of last year. So it is a significant number of infections still going around. And I think that, is going to lead to eventually a flattening out in what we see with our hospital numbers, which might be what we're seeing in Niagara right now. Looking at the Niagara cases, it's kind of a similar pattern where we saw that flattening out. We did fortunately see a little bit of a dip again, but we maybe are starting to flatten out or potentially trend a little back upwards. And again, the number of people with COVID-19 is still much higher than we were in the summer and fall, getting into the winter of last year. And so there's still a lot of infection and quite a bit of risk going around. When I look at the outbreaks in Niagara, as we got out of the Omicron wave, we saw those outbreaks steadily decreasing. But you can see again here that over the last week, we have seen that number of outbreaks start to trend up again. So both a sense that our cases and our outbreaks are maybe starting to trend back up. Sorry, the hospitalizations and outbreaks are starting to trend back up again, which is a little bit concerning. Looking at the percent positivity, so percent of people being tested who end up testing positive for COVID-19. This orange line here is the percent of tests that are positive for COVID-19. And you can see it was declining for a good period of time, but unfortunately, lately it has been starting to go back up. Now, partly that may be explained by actually fewer people being tested here. This dark line is the number of tests being done per day. So if you have fewer tests and people who are actually not infected with COVID-19 are the people not being tested, you end up with a smaller denominator, which is going to mean that your percent positivity will go up. But I do wonder if perhaps some of that percent positivity could be an early warning sign if infections might be starting to, be brewing and starting to go back up. The Niagara trend here pretty similar. Percent positivity came down, but unfortunately it has started to go back up. And the other important thing to highlight is, of course, percent positivity remains much higher than has been at any point prior in the pandemic, higher than we were in our, first, second, or third waves of the pandemic. So that does imply there's a lot of people who are out and about with symptoms who do have COVID-19, because when we do test them, it's quite probable that they do come back with a positive test. With that, I'll go to our first, warning sign, which would be the wastewater signal, which should be the first thing that we might see to start to go up. On a provincial basis, there is a slight upwards trajectory for that wastewater signal. If we dive into a bit of a regional breakdown in the province, you can see it does vary a little bit. This is kind of the central east GTA, part of the province. So this is basically north of the GTA. This is east of the GTA. And you can see they have quite strong upwards signals in their wastewater. There's a more gentle upwards trend in the GTA, a very slight upwards trend in the Central West region, which is where we are in Niagara. Southwest Ontario likewise has a gentle trend upwards. So it does seem that wastewater is saying that there is maybe a little bit of upwards trajectory in terms of COVID-19, which then fits with what I described earlier about our outbreaks going up, the percent positivity going up, and maybe we're seeing some early signs, at least in Niagara, that hospitalizations are going up. Looking at the Niagara wastewater data specifically, it's hard to really make out too much of a pattern here. You can see, of course, a lot higher amounts of COVID-19 detected in this wastewater treatment plant in St. Catharines during the December-January Omicron wave came down, has remained higher than it was through the summer fall, as has been consistent with other metrics. Not sure we're necessarily seeing that upwards trajectory here, which is a little bit reassuring. We look at the Niagara Falls wastewater treatment plant here. Again, there is this one day with a big blip, which I don't know, could be a harbinger that maybe something is happening, but it's hard to read too much into one day. If you take that one day out, we're higher than we were in the summer fall, but it's hard to necessarily say we're seeing much of a trend upwards yet. So all told, I think it's hard to really read too much into this. There are some warning signs with the provincial wastewater data, with the number of outbreaks we're seeing, with the percent positivity, with the hospitalizations in Niagara, that things might be starting to trend upwards. But some of our other metrics are still showing things are maybe still a little bit flat, and their things are maybe not trending upwards. But even where they are flat, they're of course flat at a higher level than we've seen in the summer fall. And I think that's consistent with what we're seeing with a fairly high number of hospitalizations, higher deaths than we're seeing in the summer fall still. And there is still more opportunity that we can do to bring infections down and make sure more people are going to stay healthy in our community. If I look then at what the Ontario Science Table has been modeling, their modeling, shows, of course, these are hospitalizations, that these have come down. But there's a couple of different scenarios that we might undergo in the coming weeks. One scenario is that we sort of flatten out, which is I think what we've kind of been experiencing, at least maybe seeing a little bit in Niagara, and things stay fairly flat. Or we see a bit of an uptick again. And that's all about how much does infection transmission increase in the coming weeks. And if you look at the subhead here, they talk about if people increase their social contacts by 40% while wearing masks only half of the time, that's what brings us to that kind of orange scenario. That implies that, of course, people limit their social contacts, they keep wearing masks, we're more likely to stay on something closer to that green trajectory over the next couple of months and not necessarily experience that kind of wave. This is the ICU numbers, and you can see kind of the same trend. We could have a kind of flattening out, and eventually in the summer we come back down, or we actually see a bit of a resurgent wave over the next coming weeks. And I've highlighted how our hospitals are over capacity, so this would of course be challenging for them to deal with. And if we look in Europe right now, I think we can start to see that those kinds of predictions are actually playing out. And so this is what several countries in Europe are seeing right now. So these are cases. This is Italy here. You can see they had their Omicron wave. They came down like Ontario, and actually a little before us, they started to lift all of their preventive measures. And unfortunately, they're seeing that their infections are starting to go back up. The UK, similar story. They reopened everything, lifted their masking requirements and the like, and infections are going up. France again, we can see infections are going up. Germany here, infections are going up and didn't actually even have much of an opportunity to go down before they started to go up. In Ireland, you can see they've started to see a trend upwards as well. Austria here, they, like Germany, didn't have very much opportunity to go down before things started to go back up. And Austria actually last week reintroduced their mask mandates as a result of this, because they saw that things were maybe going out of control again, and recognized that perhaps they were a bit too quick to lift that requirement. And then this is Switzerland, and again, seeing an upwards trend in infections. And of course, as infections go up, a percentage of these people are going to have severe outcomes and be hospitalized. And so a percentage of people who are going to be hospitalized, we'd expect will eventually start to go up as well. And we can see that in these same countries. So the UK here in hospitalizations for the Omicron wave, and they are starting to see their hospitalizations go up. Italy, likewise. Here they've only flattened out so far. Austria, seeing their hospitalization numbers coming up and actually starting to mirror what they had during the Omicron wave. And again, they brought back their mask mandate, probably because of that. France, they've not yet seen an increase in their hospitalizations, so you can start to see them maybe leveling out, and that might be the early stages of them heading towards a similar pattern. Switzerland here, their hospitalizations are rebounding, and Ireland here, their hospitalizations are going back up. And so I think, this is the warning sign for us of what might be in store for us. The modeling implies that hospitalizations have a good chance of going back up if people start to revert back to a lot of their usual social behaviors while not wearing masks. And we're seeing in Europe how it is actually played out. That is absolutely leading to more people being hospitalized. And just looking at the science tables, key findings here, as public health measures have relaxed, increased transmission, hospital and ICU occupancy are going to increase for the next few weeks, less fortunately than in the Omicron wave, and for a limited period of time, if changes in behavior are only moderate. And so I think what they're flagging here is that those scenarios are assuming that, that 40% increase in social contacts, half of people keep wearing masks. If we're less than that, of course, the trends are going to be worse, but hopefully we can be better than that and keep the trends actually lower. And the other point I just want to quickly highlight here is that older adults, immunocompromised, unvaccinated, marginalized individuals are still susceptible to severe illness from COVID-19. And they're potentially the ones who would suffer the most if there were another wave that comes forward. And we do see that increase in hospitalizations comes forward. I want to take a moment here to just highlight some work done by Tara Moriarty, who's a assistant professor, at the University of Toronto. And she's done some really interesting work trying to estimate what have been the number of deaths from COVID-19, how many deaths have we actually prevented, and what could we expect to see coming down in the future. And so looking at Ontario, she's calculated that if we look at how deadly COVID-19 is, Ontario could have seen up to 153,000 plus deaths from COVID-19. Now, fortunately, as we all know, we haven't seen anything near that amount. And that's in part because we've saved a lot of those lives thanks to vaccination. And the fact that we were able to control the pandemic pretty well until we got vaccines, and then we're able to roll out vaccines quite quickly to people, has meant that the vast majority of people who could have died from COVID-19 fortunately have not died. And they're basically prevented now pretty much permanently from dying of COVID-19 thanks to vaccination. Unfortunately, there were 12,500 some deaths in Ontario, so we have definitely seen people pass away. But of course, if you look at these numbers and you take this and subtract the lower two numbers, there's still over 15,000 people who could still die from COVID-19 going forward. And I think our challenge is to try and make sure we prevent those deaths, or at least as many of them as possible. If we look at a breakdown of that, she calculates that just under half of those are people who are unvaccinated or don't have yet their booster dose. And so if we are able to continue getting more people vaccinated, we can actually prevent close to half of those deaths going forward. Unfortunately, there are the people with 3 doses vaccinated who, unfortunately, some of them are still going to be susceptible to dying. And that goes back to what I was just showing you on the previous slide about people who are immunocompromised or marginalized who are at greater risk. And so, our goal is we want to, of course, get these people vaccinated. And if we can keep COVID-19 low and under control using all of the different means that we have developed over the last 2 years, we can hopefully prevent these people from dying as well by making sure that there's not a lot of COVID-19 going around. I want to highlight, though, that the people who are at risk is, of course, some of the people who are marginalized. And so, people who are lower income, if we start looking at neighborhoods by quintile, so quintile 1 to 5, quintile 5 are the 20% highest income neighborhoods, quintile 1 the 20% lowest income neighborhoods. And these are the COVID deaths experienced through each wave of the pandemic that we have had. And I think it's pretty obvious there's a trend here that the lowest income quintile neighborhoods have consistently been the quintile that experienced the most deaths. And then, of course, there's been fewer deaths as we've gone down that quintile. And I think this really represents that people who are marginalized, people who maybe work in lower end service jobs, who don't have the same resources to maybe isolate if they do get sick with illness, who maybe live in more crowded housing and are more at risk if someone does get illness in that home, they are more at risk of actually dying from COVID-19. And so by, as long as COVID-19 is circulating, some of these more marginalized, less well-off people in our society are the ones who are at greater risk. And the more we can do to control the pandemic, the more we can actually equalize the burden of COVID-19 in our community and make sure that these people stay healthy. And then, of course, there's people who are older, people who are immunocompromised, and they're, of course, at risk. And, there's some headlines I've seen in news here in the United States. People vulnerable to the virus and who are high risk feel the pain as the country is moving on, and they feel that they're being ignored and abandoned as everything returns to normal. People stop worrying so much about COVID-19. But of course, they are still very vulnerable and they're feeling left out. More closer to home, here was an article in the Hamilton Spectator recently about immunocompromised people. All the vulnerable people feeling left out as things normalize, and they feel that they're going to be bearing the risk going forward. Likewise, an article last week basically showing the same kind of issue. And I think it's really for these people that we want to do what we can, that's reasonable, of course, to try and limit the spread of COVID-19. We keep the number of infections low, we protect these people, we make sure our society remains more equal, and everybody is able to start to enjoy the end of this pandemic and moving forward from that. Obviously, one of the solutions I've talked about is, of course, to get people vaccinated. That's 7,000 plus deaths in Ontario that we can hopefully prevent. This data from the science table shows you that with 3 doses of vaccine compared to 2 doses, absolutely higher antibodies you have and more protection. And so that means people are going to be more protected from passing away or having a severe illness themselves. But also it means that they're less likely to be transmitting COVID-19 to others and making others sick. And so that's something we are doing to protect ourselves, but also protect the people who are vulnerable around us, as I just showed you some headlines around, so we can make sure they're protected going forward. We take a look at our vaccine uptake. Orange lines here are the first doses, the blue lines are the second doses, and then the green are the third doses. We can see that amongst the adult population, who's the main group that's recommended to get booster doses, we're closing on 60% of them having a booster dose, but there's still room to grow. And that room to grow is, of course, in the 18 to about 60-year-old per population here, who has much lower uptake in those booster doses than if we're looking at our 70-plus population. This age group, of course, I think recognizes they're at risk of COVID-19, and so they have been much more enthusiastic about getting their booster doses because they see it as really critical protection for themselves, and quite rightly so. But I think it's critical for the rest of us to make sure we've gotten our booster doses and encourage the people that trust us to get their booster doses as well, so that, of course, they're protected, but more importantly, that they're not going to be spreading infection then to these more vulnerable people. And if we do that, of course, we are going to be able to control this pandemic much more easily going forward and make sure we keep those most vulnerable safe in our community going forward. Just want to show you that, the trend of our vaccine protection over time. Hospitalization, ICU, people who have at least 2 doses of vaccine remain very well protected against those severe outcomes. With the Omicron variant, unfortunately, we haven't seen as good protection, but you can see here in late December, January, as we got booster doses out to people, their protection went back up. We've seen that coming down a little bit of late. Part of that is probably that the vaccine's immunity has waned a little bit. Going back a couple slides here, we do see that 1 month after your 3rd dose versus 6 months after your 3rd dose, there is a decline in your antibody levels, and so your protection is going up. And so we're probably seeing a little bit of that waning of immunity. I think the other thing that we're seeing is that as things have reopened in society, people are out and about much more. Of course, vaccinated people are probably the people most likely to follow the advice we gave in public health about limiting your social contacts, staying home if you're sick, and on the like. And as things have reopened, they're the ones who start to lessen their protective efforts and start to re-engage in society. And so they're actually putting themselves at more risk. If you're around more people, of course, there's a greater probability you're around someone who has COVID-19 who can then spread COVID-19 to you. And so this decline we're seeing is probably an impact of partly the vaccine waning, but partly the behavior of vaccinated people to be more likely to be participating in higher risk activities that put them at greater risk of COVID-19. And so I do think probably the vaccine's protection is maintained, but it highlights the importance of actually personal behaviors as part of what's going to make sure that we stay safe from COVID-19 as well going forward. And of course, that one key personal behavior that I would highlight here is wearing masks. This is some research done by the CDC showing what are the reduction in your odds of testing positive with COVID-19. If you wear a cloth mask, your odds of testing positive immediately are falling by over half. As you go up to a surgical mask or an N95 or KN95 respirator, you become even more protected going forward. And so I think that's really important for us to protect ourselves during this period where I think COVID remains relatively high in our community. But it's not just about protecting ourselves, because when we wear a mask, we stop ourselves, if we are infected, from spreading infection to someone else. And if we are infected and have no symptoms, which is quite possible if you are vaccinated, we can sometimes still spread to others. And by wearing a mask, we protect those people more vulnerable in our community. And so I do recommend that even though masks aren't required anymore, it's a good thing for us all to continue wearing them so we stay safe, but more importantly, we keep the people more vulnerable around us who are really feeling worried and feel they're going to bear the burden of their health risk with all of the measures being lifted, that we're still doing our part to make sure we protect them going forward. And then the other part, of course, to make sure we protect those people is a lot of the stuff I talked about at our last session. about how we can make some adaptations to our society to make sure we keep everybody safe by reducing the burden of COVID-19 in a sustainable way long term. I'm not going to go into all of that again, just due to the interest of time, but I'll maybe take a different tact here where I talk about workplaces, because many people here are business owners, and what can you be doing in your workplace to make it a safe environment and help keep infections under control. First off is I think vaccination policies remain really good. I've just shown you that vaccines protect people, and if you protect people from being infected, you're going to protect people from spreading infection to others. So I do recommend you keep your vaccine policies in place, and recommend you actually add a third dose to your vaccine policies with that third dose at 4 to 7 months, and that'll keep your business as safe as possible and make sure you aren't interrupted by workers who are off sick. Linked to this, of course, is in some settings, if you are serving clients, having a proof of vaccination requirement is also something that I do encourage and support if you do choose to keep that in place. Ventilation and filtration, I think, is key. We have learned that the virus here spreads through droplets that fall, but also spreads through airborne particles that remain in the air long term. And if we can keep our HVAC systems running and exchanging air with the outside, we can be replacing indoor air, which people might have breathed out and maybe had virus that they breathe out into it, sending it to the outside, bringing clean, fresh air so we don't have that. Keeping windows open as the weather improves does that same thing, bringing clean, fresh outdoor air so we can be sure we don't have air with virus in it. Having good filters in our HVAC system, if a MERV 13 or higher level, that will filter out virus, which is great. And taking CO2 measurements in our workplaces, if we see high CO2, that implies that the air we're breathing out, which of course is largely CO2, is accumulating in our spaces, and we can actually do things to better improve ventilation to get that air out and bring in more fresh air. Mask policies, I'd encourage continuing mask policies during this time. Infections are still relatively high, and there is the risk I showed that we are going to see a resurgence of infections. So let's keep masks on for at least a couple more months before we actually step back from those. I think one of the things that I'd like to see our society change is actually really building much more of a culture of staying home when we're sick and not going to work when we're sick. That means I think continuing to screen ourselves, so if we are sick, we stay home. Having sick time available for people so that if people are sick, that they are able to stay home and not bring that infection into the workplace and not feel pressure to come to work because they feel the need to earn income. If they have sick pay, they're going to be able to feel that they can stay home and get better. And for those people who are very mildly ill, often people I think in more senior management executive roles who feel well enough that they do want to work, let's keep those remote work options for them so they're staying home while they're sick, but they're working in a way where they're not going to be infecting others. And lastly, I do think we're going to see more surges of this pandemic in coming years. We may have new variants, and developing a surge protocol for if and when that happens, I think would be good. Surge protocol to me would mean, let's get everybody wearing masks for a temporary period again, start to screen our visitors to make sure people who are coming into our premises don't have the signs of infection, encourage people to start to voluntarily keep physical distance from each other, start to move maybe some meetings virtual, to really do things that we can do to limit the spread of infection during those periods where we do see waves coming. I know vaccine policies and mask policies are going to be unpopular with some, but I actually think that when I look at polling, it does seem to show that the majority of people do support them. So this was polling done by Abacus Data back in February, looking at vaccine mandates. And we can see here that, close to 2/3 of people felt that keeping proof of vaccination requirements would make sense for at least a couple more years. So I think there's actually quite a lot of public support for those kinds of measures. Another bit of data here from ECOS, similar kind of conclusion, carrying proof of vaccination to attend some of these events, close to 2/3 support nationally that we could keep those measures in place. And then most recently, if I'm looking at this survey done by Angus Reid, if you're looking at vaccine passports here, 67% support in Ontario for them. And then this survey also looked at masks. And if we look at masks, 75% of people in Ontario continue to support wearing masks in public places. And so I think some policies around vaccination and masking, while there will be a vocal minority who will oppose them, I do actually think a majority of people do continue to support those. And I think it would be good as much as possible that we can continue having some of those policies to make sure people stay protected. We in public health, put out messaging, and you can definitely reference us if you do have any of those policies that we are keen to recommend. We've also just launched today these posters, which you can download from our website. So if you are one of those places that still requires masking by provincial requirements, such as a healthcare facility or transit authority, you can, of course, use this poster. But if you're actually just voluntarily going to request people keep wearing masks, or you're going to have a policy where you've decided to continue having a mask requirement, we do have this poster that you can use to put up in your premises to hopefully encourage people to keep. Last thing I just want to then mention here as I couldn't to close is I think I saw this cartoon the other day, and this I think reflects how hopefully many of us are feeling, that we are past the worst of this pandemic, but we can still see in the rearview mirror, and we know it's not over, and we do still need to keep driving forward to make sure we don't see that virus coming at us. And it's not it's not time yet to declare that this pandemic is over. Again, we've done really well in this pandemic. A lot of lives have been saved, but as I showed you, there's about 15,000 more lives that we can save going forward, and hopefully we can find a way to do that. And my analogy for where we are right now is that we're in a hockey game. We've got the lead because we've done pretty well. We're in the third period. The game's not over, but we're in a good position right now. The thing we want to make sure is we don't blow that lead that we've built over the last 2 years and really start to see, unfortunately, more people passing away, see a new wave, see any kinds of new restrictions on our social activity and on our businesses. And so we want to make sure we keep up our preventive measures going forward. Vaccination, masking being the really key ones, doing things to keep our workplaces safe and making those adaptations in our society. And if we do that, I think we can get to the end of this third period and win the game and basically emerge from this pandemic really successful. So I'll stop there and we can go on to some of the questions.
Dr. Hirji, thank you so very much for the update. I have to say, following each one of your espressos that you have with us, we get really good feedback on exactly that. And I think by giving us the update, you actually answer a lot of the questions that have come forward in the last 2 weeks. So thank you from everyone who's here and those ones who are actually going to watch the taping of it afterwards. When I look at the questions that have come in via the chat, as well as the ones that have been texted and emailed to us, it really fits into 3 categories. One of them has to do with the lifting of restrictions, and many of them you have addressed. There's a couple of questions regarding traveling and self-isolation, and then overall the vaccinations too. You've addressed some of them, but I thought it's good to maybe dive into some specifics. And so for us to start out with, let's take a look at lifting of restrictions. And one of the ones that has come forward is, can you speak to the policy disparity between the province, some of the school boards, and the post-secondary institutions when it comes to that, especially with all the lifting of restrictions, and then those institutions actually making quite different choices or their own choices in moving forward?
Yeah, I saw this was one of the questions submitted in advance, and unfortunately, I don't think I have a very good answer to provide. It's probably more something we need to hear from the province. What I think we've seen is some school boards, I think about Hamilton Wentworth School Board, Toronto District School Board, they wanted to continue with a mask policy, at least for a couple more weeks, recognizing people travel over the long weekend. There's going to be perhaps a new surge of infections, as the science table is saying. That would make sense to continue with masking for a little bit longer. Some private schools have also attempted to do that. And the province has, while they've taken away the requirement that school boards have a mask requirement, they've now apparently issued a directive that the school boards and schools cannot actually, choose to actually have that masking requirement, which is very different than what they're actually saying to the private sector, which is the private sector that there's no mask requirement. You can choose as a business you want to have a mask requirement. As a school board, you cannot. And I don't really have great insight into that. My worry is that, I think one of the successes we've had in Canada compared to the US when it's come to the pandemic is that we didn't let things get politicized. Masking became this cultural issue in the United States, which it really wasn't here in Canada. And I worry that as we enter a more political season with an election coming up, like a federal leadership, debate, that maybe this issue is starting to emerge more into a political issue, and unfortunately that might be what we're seeing here. That's a bit of speculation. I haven't heard directly from the province on this, but that is my worry of what's playing out.
Okay, I appreciate that. We have one of our participants today is Christine, and they're asking if you could comment on whether the April 27th masking changes will include agriculture and greenhouses. And just for everyone, as I mentioned in my introductory comments, is that as of April 27th, there's a lifting or anticipated lifting of mask requirements for medical facilities, hospitals, and other ones. But when it comes specifically to the agriculture and greenhouse sector, I was wondering if you could speak to that.
Yeah, so I believe for the agriculture and greenhouse sector, it's not actually in a provincial regulation requiring wearing masks, but there is a guideline requiring wearing masks. So guideline is softer than a regulation. It's not quite as enforceable, but it is the best practice that the province continues to have in place. I don't know if they will be changing that guideline come April 27th. So we'll have to wait and see, but for now it is a guideline. It's not actually a regulatory requirement.
Yeah, makes sense. If we shift slightly here, and there's always been a confusion over the last year or year and a half when it comes to traveling, regulations, self-isolation, and so on, has been a lot of movement there, and not always the same amount of clarity that maybe some people have looked for. There will soon be no isolation requirement for any individual who's exposed to the virus outside of their home. With March break just behind us, we saw a substantial increase in the number of travelers that are there. What are the isolation rules at this time? And I'm not sure, this is where people are asking, is it different for people who have traveled abroad, coming back into the country, for people who've traveled to Quebec, people who are traveling within Ontario? If we could get some clarity on that.
Sure, yeah. So I'd say if you traveled within Canada, there's no particular different rules for you. You don't need to really be concerned about it. If you were around someone who had COVID-19 during your travels and you are someone who's been fully vaccinated and have your third booster dose, you're recommended to wear a mask for 10 days, but you don't actually need to isolate. That's as far as that requirement goes at that point. For someone who traveled internationally, and I'm going to focus on age 12 and up. If you're under age 12, you basically just follow whatever your parents have to do. This is the simplest way to explain it. If you are vaccinated with 2 doses, you don't have any kind of quarantine or isolation requirement when you come back, but it is recommended provincially that you are wearing a mask for 10 days after you come back when you're in indoor spaces. So no requirement to isolate or quarantine, but you are wearing a mask. If you don't have the 2 doses of vaccines, when you do come back, there is a requirement that you quarantine for 14 days. So only the people who are unvaccinated, so don't have 2 doses, have traveled internationally and are above age 12, they need to isolate for 14 days according to the federal quarantine requirements. Everybody else just needs to wear a mask if they come back from travel.
Excellent. Thank you very much for clarifying that. I'm going back one more time because there's 1 or 2 questions that have come in via the chat regarding the just office requirement restrictions being lifted. And this one is from Trudy, and they're asking, what are your thoughts on offices that don't require masks when seated at their cubicle or at their desks? With airborne transmission, do these 2 meters of cubicle walls make a difference in preventing the spread? And again, this is now up to the organization to put this in place too, because each organization is making their own call on this. But what are your thoughts on it?
Yeah, so I think I would really encourage any organization that if you have people who are within 2 meters, to definitely have a masking expectation there. If you have cubicles where people are separated 2 meters apart or with some walls, I think it's maybe a little bit more reasonable not to. As a person highlights, though, that people breathing out, if they happen to be infected, they're going to be breathing out virus, which can collect in the air. That 2 meters is going to make it difficult for that virus to immediately go right to someone. So there's an opportunity for us to use ventilation and filtration to remove that virus. Likewise, that barrier, while virus can go around a cubicle wall and onto the other side, it is going to dissipate as it goes across that barrier. And again, the goal would be to have ventilation filtration measures in place so you can remove that. If you don't have a good ventilation filtration system, I think that's where it's really important that people at a cubicle definitely should keep wearing a mask. If you're concerned about your health, absolutely, I would recommend you wear a mask, maybe encourage your coworkers around you to all wear a mask, and you can all voluntarily choose to make yourself safer. Key thing though is that I think you want to focus on the ventilation and filtration to make sure that the air is safe and is not going to be carrying virus. And only when people are actually close together is where it's absolutely necessary to wear the mask.
Yeah, that makes sense. Coming to vaccinations, in Canada, an individual with 2 doses of COVID-19 vaccines is considered to be fully vaccinated. We've never adjusted it to change to 3 or 4 doses that are there. 2 seems to be the rule. Many individuals received the 2nd dose as much as 9 months ago. And going into the summer, travel plans are on the rise, with many individuals looking at really wanting to travel where they haven't been able to travel for a while. Do they still have the protection against the infection, although they were vaccinated so long ago?
Yeah, so with the Omicron variant, we found 2 doses of vaccine don't give you a lot of protection against the infection. It gives you very good protection against being hospitalized, being in an ICU, passing away, getting long COVID. So it's really good for that purpose, but it's not necessarily going to prevent you from getting a milder infection. So of course, if you're, have not got your 3rd dose, absolutely strongly recommend you get that 3rd dose. That 3rd dose is what then gives you that protection again against the Omicron variant. For people who are a few months out from their booster dose, your protection is going to be reduced a little bit. It does seem to be lasting over time. It does not seem to be going down to quite as low as it was, or nearly as low as it was with the 2 doses waning. But it's definitely not going to be as good as it was before. But you're still looking at least 50% protection, I would be thinking.
What can people expect looking at the fall time now? And there's always the anticipation that likely numbers will increase again as the weather is changing, as we're spending more time indoors. So what do you foresee for people and their vaccination needs going forward?
Yeah, I think there's a possibility we may get a fall booster dose. And, there's been lots of speculation. Is this going to become like influenza where we get an annual flu shot and becomes a fall, COVID shot as well? Hard to know for sure if that's going to be happening. I'd say, the 50% chance that might happen, but we haven't seen the scientific recommendations yet come out in Canada necessarily recommending it. So, I think it's wait and see. There's also, as you mentioned in your introductory comments, we've had some new vaccines actually be developed. And maybe we actually end up with a vaccine that's going to give us more permanent protection. So there's always possibilities that that doesn't become what transpires. But, I think it's a reasonable possibility we'll be expected to get a fall COVID shot.
A couple of questions I would like to get into because we have only like a couple of minutes left. Julianne, they're asking, are business and organizations still required to have and post safety plans?
I need to double check the regulation on that. I don't think they are. I think that got lifted yesterday along with the mask requirements, but I'd encourage you to double check Ontario Regulation 364/20 because that would say for sure.
Okay, and we will make sure too, we'll follow up with all of our participants on it too, and we'll share this. Brian is asking, may I ask if we'll see a recommendation for a 4th booster shot, given that it seems apparent that vaccine efficacy wanes over time? And I think we already touched base on that, but any specific comment on this?
Yeah, nothing more to add on that. I know some countries like the UK, Israel have gone ahead and they're actually experiencing new waves right now, which is, I think, partly why they've gone in that direction. I know the vaccine companies are trying to get authorized for a 4th dose. Of course, they have a little bit of a profit motive behind that as well. I really want to see what the National Advisory Committee on Immunization recommends. I think they are the most trustworthy source for vaccinations here in Canada, and we'll wait to see what they recommend.
Yes. Nancy had emailed us a question, and there was one of the local community health centers. Is there an anticipated date for removing screening questions at healthcare facilities and private businesses?
That's again a little bit of a provincial issue because they're the ones requiring that at this time. My guess is they're probably thinking April 27th that they would take that away. As I've talked about, I actually think screening though is a good thing to start to build a culture of people always checking themselves for if they're sick with infection and not coming to work and perhaps spreading an infection around. So I think it's probably going to go away April 27th, but would encourage that we actually all continue to do it.
Yeah. A question has come in from Margaret. For staff that are not vaccinated, can we accept anti-human antigen testing? Are there other ways that we can maybe see and work with that group?
Yeah, so I'm looking at the chat here. I think she's looking for antibody testing to find out if they have immunity or not.
Yeah.
Unfortunately, we don't have a lot of good research to know how well those antibody levels necessarily correlate to immunity. We also find that, not all antibodies are the same. Antibodies you may have gone with a pre-Omicron variant don't seem to give great protection against Omicron, whereas the antibodies from vaccine do seem to give a bit better protection against the Omicron variant. So unfortunately, that's not right now going to work out as a great correlate for whether or not one has immunity.
Yeah, makes sense. Let's, a couple of questions have come in regarding Deltacron, a hybrid of Delta and Omicron. It's a new coronavirus variant detected in mid-February. We hear and read about it. Does it pose a threat to us? And can you give us a bit of insight on this one?
Sure. So I wouldn't characterize it as a variant per se. What's happened is that, as the Delta wave was coming down, the Omicron wave was building up. So there are some people who are infected with both Delta and Omicron around the same time. And those two viruses kind of cross-matched and kind of mixed up a little bit. And you end up with the Deltacron virus, which is kind of shows some of Omicron and some of Delta. Thus far, we have not really seen it to be building up very fast in any country. So it doesn't look right now like it is any kind of threat. And it's probably just going to fade out the farther away we get from the point where both Delta and Omicron are around. Obviously, we're going to keep paying attention to see if that changes. But right now, that doesn't seem likely to be a threat for us.
I think a lot of employers and a lot of people who have actually joined us today are really wanting to keep people informed and educated on everything that is going on. And there's a question here that's asking, despite many media reports of the vaccine being unsafe, is it still believed to be safe and best protection, as you had outlined in your presentation as well? Is there education you can recommend to help with the potential misinformation? Are there specific links? I know that all health units, provincial government, federal governments, the World Health Organization, all are trying to share the information, but other specific ones that you have found to be very successful?
So absolutely, vaccines remain extremely safe. Like any medication, there are side effects. So yes, we do see a very small percentage of people who unfortunately do have a bad side effect. You can go look at the federal government website and all of that data is listed there. It's extremely small and far, far less common than people getting a severe outcome from actually getting COVID infection. As you mentioned, all of the public health, federal, provincial, World Health Organization have the information on vaccine safety. I believe Sunnybrook Hospital has a bit of a online course that's good as well. So that's another one that you could look at. Sick Kids Hospital actually put out a website as well. There's a bit more tailored towards vaccine safety and information on vaccine in children. That would be another good one that I'd recommend. So those would be a couple I can think of off the top of my head.
Okay. You, in your data that you shared with us, you indicated that there's a little bit of an outbreak. Some of the numbers are going up. Are we seeing those numbers coming from certain demographics, specifics that might actually help us in making better decisions and to ensure that not only we are, but our community as a whole is safe?
Yeah, so it's there's two parts to this. When we look at just the infections going up, it seems to actually be in younger people. We're talking 20-year-olds, 30-year-olds, 40-year-olds, which sort of makes sense when you look at our vaccine uptake and our booster uptake. Those are the age groups who don't have the booster doses as much, and so it makes sense they're more likely to be getting infected. When we look at the severe outcomes, the people infected in those outbreaks, the hospitalizations, those tend to be much more older groups, and then some unvaccinated younger groups. And that kind of makes sense. They're the ones who are most vulnerable to getting severe illness. And kind of the key message I'd say there is that if we're younger and we don't have that third dose, get that third dose. So we're not contributing to those infections that are then finding their way to the older people who are then becoming hospitalized.
Yeah, Excellent. Last questions to get to, and a lot of business has inquired with us, with chambers across Ontario regarding the rapid antigen tests. Do you think there's still a role for those tests, and where do you see best suited fit, and when it comes to organizations and organizations' commitment to keeping their staff safe?
Yeah, no, I think there's definitely a role for them. At an individual level, it's fortunately easy to get a rapid antigen test now at supermarkets, pharmacies. You know, I've got a couple boxes, and I think the role to use there is that if you did get sick with symptoms that are similar to COVID-19, you're able to test yourself, find out if you have COVID-19, and really know if you should stay isolated. If you've been around someone who has COVID-19, especially someone outside of the household, even if you're not required to isolate, good idea to take a rapid test every day, every couple of days, so you can find out if you do become sick and make sure that you're isolating right away and keeping others around you safe. For a business, you know, I think the first role would be to encourage that, which is part of building that culture, that you don't come to work when you're sick and spread infection. I think there could still be a role where you're going to use that rapid antigen test once a week, twice a week for employees coming into the workplace, just as an additional check to make sure that they're not infected and bringing infection into the workplace, similar to what's been done in past months. That did, I think, actually have effect at keeping workplaces safe, and I think it's a good practice to continue on.
We agree, and we really have been pleased to have been partnered with the Ontario and the federal government on assisting in the distribution of those tests as well. Dr. Hirji, as always, on behalf of our members and my colleagues, thank you so very much for giving us this important hour once a month. It's really critical to us. This webinar has been recorded, so for everyone here in attendance, this will be available on our website and will also be emailed as a follow-up to you directly at the same time. A number of resources were mentioned, and those will also be shared with you in a follow-up email, and any information that you might need, please turn to Niagara Public Health, or we have also an extensive list of resources available on our gncc.ca website. And lastly, to all participants, thank you for joining us, and stay safe.